Hello and welcome to MyVA Dayton, coming to you from Dayton, Ohio. This is the show where we talk to veterans in the Central Ohio region to share their stories and share what's happening at the Dayton VA. I'm Scott Leese, your host with co-host Greg Tucker. We have with us today an Air Force veteran from Enon, Ohio in Clark County, Crystal Baker. Welcome, Crystal.
Thanks for having me.
We're glad to have you here today. Crystal is a Clark County Veteran Service Officer. She is also a member of the National Association of County Veteran Service Officers and Ohio Association of County Veteran Service Officers. She is also an active Springfield CBOC Veteran Stakeholder Committee member. While in the Air Force, she served as a security specialist guarding nuclear weapons. Again, welcome, Crystal.
Thank you.
Well, before we get to know a little bit more about you, we're going to put you to the test.
It's time!
That's right, it's time to play Don't Tell Me, I Think I Know That. This is the game where we put our guests to the test of their knowledge of military trivia. A game where our listeners can play along to see if their minds are mired in mounds of military minutia. Are you ready to take that challenge?
I'm ready.
Okay. Since you're an Air Force veteran, we have actually tailored these questions especially for you and for your background. Since we were talking about you actually guarded nuclear weapons, we'd like to know, here's your first question, we'd like to know how many nuclear warheads are in the U.S. right now? Would it be A, 300,000, B, 30,000, C, 3,000, or D, 300?
3,000.
3,000? That is the right answer. Great job. As of September 2020, the U.S. had 3,750 nuclear warheads to be exact. That's actually 88% lower than the U.S. peak's number back in 1962, where there were actually 31,255 nuclear warheads. That's quite a dramatic reduction. The current inventory includes active and inactive warheads. It does not include about 2,000 retired warheads scheduled for dismantling. All right, here's your second question. What does the Air Force call the Director of Security Forces? Now, you being a cop, you've got to know what the answer to this is. The Director of the Security Forces is known as A, the Sheriff, B, the Marshal, C, the Top Cop, or D, the Top Dog.
The Top Cop.
The Top Cop is the right answer. That's right. The Director of Security Forces is a Brigadier General and the highest ranking Security Forces officer, sometimes referred to as the Top Cop. The Director of Security Forces reports directly to the Deputy Chief of Staff of the Air Force for Logistics, Engineering, and Force Protection. Now, here's your third and final question. This is for the big money now. Who was the first female U.S. airman killed in the line of duty in support of Operation Iraqi Freedom? Would it be A, Taylor Swift, B, Elizabeth Taylor, C, Elizabeth Jacobson, or D, Raquel Jacobson?
Elizabeth Jacobson.
That is correct. Yes, Elizabeth Nicole Liz Jacobson was a United States Air Force airman who was killed in action in Iraq War in 2005. A member of the U.S. Air Force Security Forces, she was the first female U.S. airman killed in the line of duty in support of Operation Iraqi Freedom, and the first Air Force Security Forces member killed in conflict since the Vietnam War. Well, great job you did here with us, Crystal. So, Greg, tell us, what has Crystal won for playing our game today?
Well, Crystal, we have a set of VA industrial strength chip clips designed by NASA's aerospace engineers to keep your chips crisp on your next stellar space journey, or wherever you may be traveling in the near future. All of this is compliments of the Dayton VA.
Great, thank you.
And we're going to take a quick break now. When we come back, we'll hear more from Air Force veteran Crystal Baker about her work as a veteran service officer and her experience in the Air Force.
Even an Iraq vet like me who's in really good shape needs good health care, especially when it's top quality and convenient. And it's not just for men. In fact, aren't you a vet, Patricia?
Yeah, I served in the Air Force.
When I come to the VA, the people understand veterans' needs. I get great care with good doctors and nurses and state-of-the-art facilities. Because, hey, I was there and I earned it. And if you deployed to Iraq or Afghanistan, including with the Guard or Reserves, you did too. Here's another thing. I'm within 5 years of my time over there, so there's no copay for any service-related condition. That makes a difference to me. So why not come in today? When you check in, you'll get a full medical exam, first thing. Free for vets at the VA. Thanks, Doc. So check us out and see you here.
I was in the military. I didn't know that when I left, I was eligible for health care through the VA. I thought you had to be disabled or been wounded. Another vet told me I should check it out. Now, I have the care I need at the Dayton VA.
Don't wait another day to see how the VA may help you.
I'm a vet, and it's my VA. Make it your VA today.
Call 937-268-6511, extension 2159 to enroll, or visit dayton.va.gov.
And we're back with Crystal Baker, a veteran service officer and an Air Force veteran. Crystal, tell us, if you would, please, what is a VSO? What is a veteran service officer? What do they do?
So our goal is to get veterans to come in and see what they're entitled as far as benefits, whether it be health care, compensation that they need compensated for because of something they went through or were exposed to, and pension, which is an income-based program. If they don't make very much money, they can come in and have their income supplemented through the VA.
Great. Tell us, what has been your greatest reward as a VSO?
Just helping others to see that you're changing someone else's life.
And are there any great examples of you having done that? You know,
Sure.
Is there a particular veteran or a particular experience that you went through that was particularly rewarding?
Yeah, I have a veteran who came in and filed for hearing loss. He was granted at 100%. Prior to that, he had no income, so now he's getting over $3,000 a month, getting all of his health care taken care of, and it's just life-changing for him. Hearing aids, and now he can actually hear when people are talking to him, and yeah.
So you said 100%. Tell us what that 100% is. Tell us about the whole aspect of getting a certain rating.
Sure. So the rating is based upon, first they decide if it is due to your service, and then how bad it is.
And so we often call that a service-connected disability?
Yes. And it can be rated anywhere from 0 to 100. 0 is still service-connected, saying that it's caused by the military. It's just not bad enough for them to pay you yet.
Okay. But when you get a higher rating, what does that do for you?
Gets you qualified to go to like the Dayton VA or the clinic, get all your meds, get all of your health care, not just one specific service-connected condition. You can be treated for any condition, not just your service-connected condition, once you're 50% or above.
All right, fantastic. Well, tell us, what is the process for getting a service-connected disability rating?
So Ohio is lucky because we have an office like mine, a veteran service office, that we have one in every county. So whatever county is closest to you, whether you work there or live there, you can go to anywhere in the county and go in, and the VSO will do all the paperwork. You might just have to provide your private medical evidence to show that you do have hearing loss, like that gentleman, for example. And then once I submit it to the VA, they'll get a call from the Dayton VA, or there's 3 companies that the VA outsources their exams for, and they'll go in for the exam. That examiner turns in the paperwork to the VA, and they will decide if it is service-connected or not.
Crystal, do the veteran have to be in that county, or?
No, they can go to any county. I actually have a couple veterans who I help from even out of state, Kentucky, Alabama. It's just they can't go for emergency financial assistance in a different county. You have to go in the county you live in for emergency financial assistance.
But for help?
For help with compensation or pension, you can go to any county.
So if someone was traveling through, say, transit, homeless, traveling through, how would they locate their VSO or the Veterans?
They could go
Services.
to one of, like the Dayton VA has a service officer, I believe, that could file a claim there. Or if they happen to go to the clinic, I'm sure someone at the clinic would direct them to our office. I know at our office, we have a list of every county, their addresses, their phone numbers. So if somebody calls and they say, I'm from Champaign County, we can tell them exactly where to go and who the service officer is and where they're located.
So, since you work for the county, basically, can people go to say, for example, the county courthouse or some other county office, and they would be able to direct
Yes.
them to you?
Yes. Yep. Or Google.
Or Google.
Yeah,
Google. Everything's there on
the
Google.
internet.
Absolutely.
Okay. Or what about the employment office?
Yes. Actually, we deal closely with Job and Family Services in Springfield. We have a vet rep there who helps veterans create their resumes and apply for jobs and trains them on, how to answer questions and things like that for job interviews. So he definitely would know where to tell them to go.
So, Crystal, how many veterans have you met that really have an understanding about these services that are available to them?
Not a ton. A lot of people will say, we didn't even know your office was here. We had no idea, that this was available. I'll be honest, I didn't. My aunt called me and said, hey, this office is hiring. You should apply. And I did. And I really didn't know what I was applying for. But, I'm glad I did it. I've been here 10 years now, and I'll retire doing this.
So you were in the Air Force, but you were actually born and raised in Springfield, correct?
Yeah.
And you went in the Air Force right after high school. Why did you join the Air Force?
Well, I kind of knew that college was not going to be my thing. So my mom said, why don't you join the Air Force? And I said, okay. And we got up one day and went down off of Limestone and went to the recruiter's office, and I signed up without even a thought.
And why did you become a security forces specialist? Did you grow up wanting to be a cop, or is that you just went in and took the ASVAB and
I did.
Shazam, there
Yep.
they said, okay, guess what?
Yep.
You're going to be a police officer.
Yeah, tiny me.
Yeah.
5
well,
foot, 100 pounds.
And that's the way it works sometimes. But did you enjoy that career?
It wasn't horrible. It definitely was a learning experience, and I'm glad I went through everything I did. It taught me responsibility, and I feel like I tried my hardest. I was dedicated, and it taught me a lot. And I noticed when I came back that I was a lot more mature than the kids that I had graduated with and was still friends with.
I have to say one thing. Sitting here talking to you and actually seeing you, I am glad that you were a security forces specialist who were guarding nucleus, because if you're not here, Crystal has a very calm demeanor. So she is calm, and I think that is very important for us to maintain that composure, especially in a stressful situation. So we were very fortunate. The nation was very fortunate to have you, Crystal.
Thank you.
Absolutely. So, yeah, tell us a little bit about that experience as a security forces specialist guarding nuclear warheads. Did you ever expect to have your career path go down that road?
No. When they told me I was going to be stationed in Montana with missiles, first I was like, where's Montana? And then, being told that it's very cold there, which I don't like cold weather. But
But you're from
it's
Ohio,
beautiful.
and you're not used to cold weather?
I am, but it's a different kind of cold.
It is. It's a totally
I
different
mean,
kind of
people
cold.
would be in flip-flops and shorts in 40-degree weather there, which I don't feel like is so much here. But so being there and being away from your family, you tend to have really close friends that you consider your family and kind of lean on each other. I was in a group that would deploy every 5 days, basically, and stay in a house. And
On a missile site.
yes, on a missile site. There's 10 different missiles around, or 10 different sites around this house. So whenever an alarm would go off, we would have to go out and inspect and see what set the alarm off, and make sure it wasn't an intruder or anything like that, and make sure it was secure. We would do that for 5 days on, 5 days off. And I did that for a little over 3 years.
So were there ever any tense moments?
For sure, every time an alarm went off.
Like, what kind of example would you have of when an alarm goes off? What happens? So what do you possibly see?
A rabbit. Normally a rabbit or a bird, something like that.
So small triggers, but
Yes.
not like the hordes of communists coming over the fence or anything.
Right. Or it could be, there were times when our instructor would be out there hiding. So we would have exercises. And even that is very intense.
So did you find that experience rewarding?
Yes. I guess that someone like myself could do that.
So that was fantastic information. We're going to take another quick break here. When we come back, we'll hear more about Crystal and what she thinks of the Dayton VA Medical Center.
When I retired from the Air Force, I received my medical benefits for life through TRICARE. I didn't know I was also eligible for care through the VA, some of which I pay no copay for or an annual premium. Now I have options I didn't know I had before because of the Dayton VA.
Don't wait another day to see how the VA may help you.
I'm a vet, and it's my VA. Make it your VA today.
Call 937-268-6511 extension 2159 to enroll or visit dayton.va.gov.
Hope. Where are you hiding? I search for you in the seconds, the minutes of each and every day. Hear me as I call out to you. Take my hand. Lift me up as I lift up others. Welcome me home, Father, Mother, Sister, Brother, Son, Daughter. Hear us now. Alone we stood, divided we fell. No longer. Now we choose to make the connection. Our new mission lies within. Visit maketheconnection.net to learn more.
And we're back with Air Force veteran Crystal Baker. So, Crystal, tell me, how did you discover the VA? You had alluded to it a little bit earlier that your aunt had pointed you in that direction, but what was your experience in discovering the VA?
So, yeah, I was never told there was any kind of health care available to me or anything after service. Now, granted, they might have told me, but I was in such a rush to just get home that I didn't hear any of it. But once I started working there and learning the different things that were available, I ended up filing a claim, and that got approved. And then I got a primary care physician at the clinic there in Springfield, and they ended up rebuilding down the road. They have a new clinic. It is amazing. Big, plenty of primary care physicians for each person, and I get all my meds mailed to me, which is nice. I don't stand in a line waiting at the pharmacy.
So you didn't always have that care. Tell our listeners a little bit about your personal experience with the Dayton VA. You tell us what the difference was between before the VA and now that you have VA health care.
Sure. So before I had a primary care physician who may be retiring or wasn't familiar with my story. Whereas now I have a primary care physician that knows my story. The nurse is always the same nurse when I go. It just is a lot more convenient and makes me feel a lot more comfortable.
And speaking of more comfortable, do you take advantage of the women's clinic?
I don't.
You don't?
No.
Okay, well, we'll have to have you come back and tell us more about when you actually do that.
Yeah.
Okay.
Crystal, one of the things when we're doing our outreach, we run into veterans who have misconceptions as far as about the VA, and that contributes to a lot of their hesitancy of actually enrolling. Did you have any of those?
I have definitely had veterans say no. I've heard bad things about the VA, or 20 years ago I saw this doctor and he was horrible and he didn't help me. And honestly, I'm hearing a lot better things nowadays than I used to. And I would say anywhere you go, there's going to be that bad doctor, that bad nurse that you came in contact with. But as an overall, I think that the Dayton VA is awesome. And the clinic especially is convenient for people who live there in Springfield. It's right there.
So one of the things that you saw as far as being a veteran using the VA, and that is the convenience. And with veterans that you are assisting for, what would you tell them?
I would tell them, if they had a bad experience, to give it another shot. It's different than it was years ago. I don't know, why, but it is. It's better. And there's also, if you have a bad experience, go to the patient advocate and voice those, because if you don't, and no one ever complains about the situation, it's never going to get fixed. So I always recommend go voice your opinions and they'll fix it.
Well, and one of the things that you do, you're a big part of that process of improving everything we do. You talk about going to the advocate, you talk about expressing concerns, you talk about giving it another chance because it has improved. Yeah. One of the ways it's really improved over the years is that the Dayton VA has veteran stakeholders committees for each of its CBOCs or community-based outpatient clinics, and you're a member of that committee in Springfield. Tell us a little bit about that role and what you do with the Springfield Veteran Stakeholders Committee.
Sure. So we just get together, talk about how we can make things better, get more people brought into the clinic or the Dayton VA, whichever is closer for them. We talk about concerns, or if they don't have a certain specialty, then we might try to get them to move that specialty to the clinic or something like that. They used to never have audiology there at the clinic. Now they do. So that's a big one. Hearing is definitely a big specialty to have there.
So you actually see fruition from those conversations that you have with the leadership team at the Dayton
Definitely.
VA, how we're actually working to improve not just the main facility but all our outreaching outpatient clinics as well.
So as far as filing a claim, I get a lot of veterans who say, I don't need that right now, I'm in good health, I don't need to file a claim. Or they'll say, I'm not that bad, there are people who are worse than me, I'd rather them get it. There is no set amount of money or anything like that. Everyone should get the compensation that they deserve. File a claim. The worst they can say is no, but if you don't file a claim,
and if they say no, is that the end of the line?
No. Oh, no. And I, along with the other 4 service officers in our office, we don't drop it. We keep appealing it. They'll tell you what you need to get it approved. So we'll just go try to get that information, send it in, appeal it.
And you actually talk about the veteran who says, well, I don't need it and I don't want to take away from other veterans. So often we hear that, and so often we have to go back and tell them, you don't understand. That's how the VA gets its funding. And so every veteran that enrolls with the Dayton VA, that's actually funding that comes to the Dayton VA. So if you're not using your benefits, you're not using the benefits at cost a certain amount, that funding actually goes to serve those veterans who do need it. So every veteran actually enrolling with the medical center actually is helping other veterans.
Exactly. And as far as enrolling, with Agent Orange and the burn pits, that's how they know the presumptives. Okay, all of these veterans have the same condition, and they all served in the same area. So if they're not coming in and telling the VA what they have, that's not helping another veteran.
Right, and that's, we just recently had the PACT Act signed, which is actually going to broaden those services for a lot of folks who previously may not have been eligible.
Correct.
Or that may not have even been aware that they were eligible, that we now need to make sure that they're aware of their eligibility and that they take advantage of that eligibility. So we highly encourage everyone to go to their VSO and get more information.
Yep. Yeah.
Fantastic. Well, I want to thank you very much for your service in not just from the Air Force, but also what you do as a veteran service officer, and especially your participation in the Stakeholder Committee with the Springfield CBOC.
Thanks.
So thanks again, Crystal, for joining us today. It's been great to hear your story. It's been a great story at that, especially talking about your service in the Air Force and guarding our nation and our nuclear warheads. So I would love to hear more stories from veterans from around the region.
I'm Brandon. It's MyVA. Make it your VA. If you are caring for a veteran with serious illness or disabilities, the Dayton VA Medical Center can help you support them and take care of yourself. You may qualify for services like training, counseling, or respite care when you need a break. If the veteran you care for was injured post 9/11, you may be eligible for even more services, including a stipend to help with expenses, training, and medical coverage if you aren't already covered. For all caregivers, we can provide progressive needs planning to help manage degenerative conditions, match caregivers with services and benefits, connect caregivers with local resources and programs, and listen to caregivers when they are struggling. And listening may be the biggest help of all in a situation like this. Who else can you turn to when you are facing struggles with providing care for a loved one? Who else understands the special needs of an aging or disabled veteran? The professionals with the Caregiver Support Program do. They know what you're going through and where to find additional help. If you're a caregiver for a veteran, you can get support by contacting Erin Heyman, Supervisory Social Worker at the Dayton VA Medical Center. Her phone number is 937-268-6511, extension 2858. The Caregiver Support Line is also available if you need support outside of the Dayton healthcare region, have questions about caregiver support services nationwide, or just need someone to listen to right now. Simply call 855-260-3274.
The Dayton VA changed my life. There was a time I was jobless and homeless, didn't know where to turn for help. I felt like there was no hope for me. Then I learned about the Dayton VA. They helped me find the help I needed to get back on track. I received support, got a job, found a place to live. I got my life back.
Don't wait another day to see how the VA may help you.
I'm a vet, and it's MyVA. Make it your VA today.
To enroll, call 937-268-6511, extension 5336, or visit dayton.va.gov.
We want to say thanks again to our special guests for taking time today to share their story. We truly enjoy hearing stories from veterans from across the region and learning more about how they found care through the Dayton VA Medical Center. And as always, we want to thank our listeners for joining us and remind them, if they are a veteran and are not enrolled, to enroll with the Veterans Health Administration to receive health care benefits through the Dayton VA Medical Center. It's easy and it doesn't cost a thing. You just need to be a veteran. The simplest way to start enrollment is to call our Enrollment and Eligibility Office at 937-268-6511, extension 4105. They can schedule an appointment for you to come to the Dayton campus or help make an appointment at one of the surrounding community-based outpatient clinics located at Springfield, Richmond, Lima, and Middletown. Again, that number is 937-268-6511, extension 4105. Veterans may also enroll by visiting www.choose.va.gov/health. While there, you can choose from applying online or by phone or by mail. It's just that simple, really. As I said before, it doesn't cost a thing to apply. So what are you waiting for? Call us today Or, if you know of a veteran who is not enrolled, have them call to start taking advantage of this benefit. If you're a veteran, it's your VA. Sign up today. Join us again for another episode of MyVA Dayton with the Dayton VA Medical Center. Our episodes drop the 1st and 15th of each month. I'm Scott Leese with your co-host Greg Tucker. Thanks again for listening to MyVA Dayton.